Yes.
Welcome to Pep Talk, where physios evaluate policies.
Oh, goodness.
Oh my goodness.
Oh,
What
God.
a change.
Oh, no.
Okay, so guys, today we are talking about proposed changes. Do you know the proposed changes, Mason?
Oh, my God. No.
Okay, so you.
God. I got the email.
Oh, you did?
I haven't gotten around to reading it yet.
Wonderful. Plan an academic convenient care which prioritizes making it easier for people of Ontario to connect to the care they need. So specifically for physiotherapists, it authorizes physiotherapists to order MRIs, diagnostic ultrasounds. The ministry is also seeking feedback on which x-rays physiotherapists should be allowed to order and if they should be authorized to order CT scans. This is very off the cuff. This is why I didn't tell you guys earlier.
I forgot my cuffs.
We're going to go through a couple of questions just to get initial responses because it's obviously circulating through the internets. I want to make sure that we have our say. Let's start with you, Lilia. How could being able to order imaging directly change the speed of diagnosis for our patients?
Well, can I ask a follow-up question?
No.
Okay, great. Well, will it change the speed of diagnosis? Yeah, I would say so, because if somebody comes to us as a primary care provider and what we're finding warrants imaging, they have to go back to their family doctor or some other physician who then starts the referral process. And a lot of people have long wait times to get into their primary care physician if they even have one. A lot of people don't have one at all. So for sure that would cut that off at the head.
So, Mason, do you see this improving continuity of care or could it lead to unnecessary tests?
I think so. Everything we do as physios is like best guess. And as far as we know, scans are the closest thing we can get to a certainty on an answer. So whether that answer is something or it isn't something, it kind of guides the direction of care.
Do you think you think a lot of physios are going to order unnecessary tests? Because that's a big concern. That's what people are saying. That's
People?
what the
Who
interwebs.
are these people?
That's what the interwebs is saying.
Listen, interwebs.
I mean, I've always had the stance that the purpose of our job is to test the physical function through movement, through daily activity. I think we should be ordering x-rays more so over the doctor because of that. Right? I mean...
Okay. In your opinion, we're already underusing the services. Okay.
I do.
Lily, you want to jump in? I feel like you're holding something. Do you think there's going to be unnecessary ordering of MRIs?
I think less than there are now, because I think, unfortunately, like primary care physicians, again, they're expected to triage such a vast array of conditions, and they're not able to really be specialists on everything. Whereas we carry out a niche, right? Just a certain system of the body. I think that we get to use our special tests more often, so our diagnostic tests that give us strong indicators of whether an injury is present or not. So I think there would actually be less unnecessary testing because I feel like primary care physicians, in an attempt to not miss something, will send somebody for a test because they don't maybe have all of the tools that we have to do a physical assessment.
Interesting. In an ideal world, I think so, yeah. My only concern on this point is that because physiotherapists operate a lot of times in a private sector, there are pressures that patients will bring to us. And as a practitioner that wants to have a busy schedule, full schedule, you want to appease clients, and it's going to be a very big struggle for some physios, and maybe a lot of physios, to say no when someone's coming in knowing that, hey, you can give me this test. Doctors don't really have that pressure. OHIP covers everything, so it's like, whatever. If you don't want to come back, good luck finding another doctor.
Sure, yeah.
So that's my only concern with it. I don't know how you solve it. Well, so on to the next question, which ties into it. Do you think physios will need more advanced training other than what we already have for us to be able to make these decisions? What do you think, Mason?
I don't think we need necessarily more training because like I was saying before, like our main role is to assess the physical function of that, and we do specialized tests that are, again, more in a niche area, more than a doctor would or another physician would assess. As far as warranting an x-ray or a scan, we can at least figure out if that's needed.
You're already sending patients to
Exactly.
their doctor for that anyways.
Yeah.
Okay, what do you think?
I didn't realize that this was talking about so many different types of imaging, so maybe training on like when each type is warranted. I feel like I am comfortable with maybe with X-ray and MRI, but a lot less with CT and like ultrasound. And then also we don't really read imaging, so we would be relying on like the radiologist report. But then if it's missing information that we need, I don't know that we have the training to then look at the image or anything and really get our
Which is another big
diagnosis.
question is that right now chiropractors can refer out for x-rays like Dr. John.
Yeah.
OHIP covers the reading of that. You know, they would have to have something similar where for physios, unless you know how to read MRIs, OHIP would have to cover that piece. So. Next question. So could this reduce wait times in the healthcare system or just shift the bottleneck to radiology departments? Mason, what do you think?
more people will be going to scans, but a lot of the times the delay is getting that scan to the doctor. It might be a shift from waiting for the doctor to waiting for radiology. I could see that being the issue. But then I think it's a warranted bottleneck. So yeah, you might be waiting more at the radiology, but it might happen that way no matter what.
Like the net wait time might be the same. Like reducing load on primary physician is also high value.
Yeah. So this is the last question we'll go for now. Lilia, how might this legislation affect collaboration? I know your favorite topic here between physios, family doctors, and specialists. What do you think happens in that new world?
It's a good question. I feel like there will be a period of time where there's really not the trust that we have the skills and judgment to use that wisely. So I do worry that there'd be redundancy in the beginning because our voice and opinion may not be valued to the same extent. I think in an ideal world, it would improve that collaboration, but at this point in time, there isn't a lot of overlap, you know what I mean?
Yeah.
Like we're not in that conversation, and sometimes it doesn't seem like there's a lot of conversation between a family doctor and a specialist anyway. So I don't know that it would improve it. I think blue skies world, it would be great. I don't know if that's realistic in the short term.
It's definitely going to be a change there will be a power shift, I think, and it'll be interesting how patients perceive that. Because you're right, I think most patients default to family doctors as sort of, hey, whatever they say is what we're going to go with, and then we're stuck sometimes with trying to get through what their patients truly, what their issues are. So it would be interesting to see if that power shifts. Is, hey, we can actually do the whole continuum for someone that may have a fracture. That would be interesting to see what family doctors and even specialists too. Because I know that from my experience, specialists don't have a ton of like direct conversations with physios, so it's always a bit of an indirect thing. But now it's kind of like getting rid of one middle layer. They normally interact with the family physician, and we interact with them. So, what do you think?
I actually basically two different ways of thinking right now. One, I think it's going to make the collaborative aspect of it worse, because I think even as minimal and as ignorative, push-offy as it is, at least you do have that initial communication with the doctor to order imaging, depending on who that physician is. If you bypass that, that's even less of a communication with that doctor. I know patients who come in where I'm working now, and they don't necessarily listen to the patient perspective,
Right.
And will not heavily rely on us saying something, but will at least lay it out in a more healthcare professional-ish way.
Yeah.
With the skipping of imaging, like the doctors are a little bit less informed. You could also argue that if the scan's back as more evidence-based, and it shows like, oh yeah, there's actually something serious here, the physicians might then take on more of your perspective now, because like, oh, you were right, as opposed to just, oh, you kind of just assumed that this is this, versus like this plus scan. Now what? Now this kind of opens the doorway to be like, what should we do?
And I guess we don't know for sure, but it is a good question, is that if we can order imaging, is there a requirement to inform the family doctor? I think for chiropractors for now, they could order x-rays and it never goes through the family doctor at all. That's a good point that, by skipping that, there is a downside to it. I know that they probably didn't do any research.
No, zero.
No idea this was happening. But because it's really a hot topic right now, and I know a lot of patients are probably going to start asking us a bunch of questions. It's important, I think, that we just have our initial thoughts, and as we get more information, we'll hopefully have another pep talk, which, look, still works. Physios evaluating policies. I like it. We should go back to the products, though. I agree. That time. All right, see you guys next time.